Hey, hello. Today we are going to discuss about the topic cleft lip and cleft palate. It is basically a deformity in which the two halves of the body fail to fuse with each other. Do you know what exactly it is? That our two bodies, two halves of the body, the left one and the right one, they fuse in between in a one median line. And this middle line, when it fails to fuse, when it fails to come together, that time this deformity or the defect, the cleft lip or the cleft palate, that emerges. So in Hindi if I want to say, it is चीर जाना होठों का और अपने जो ऊपर टाड़ू होता है उसका चीर जाना is what is cleft lip and cleft palate. Today we are going to discuss about this topic. You know that this disease or deformity was considered because of the evil powers or because of the effect of solar eclipse on the pregnant woman. It was considered that when during the solar eclipse, if the pregnant woman chops vegetables, she would get this, like her child would get this deformity. But yes, with the help of science and lot of research and study, we have understood that this cleft lip and palate is nothing but a birth defect. So today we are going to discuss on this. Hello and a very happy morning. I am Dr.Mansi Shah, your oral health consultant, and you are here watching my show Monday Mornings with Mansi. You are here now on my channel Dr.Mansi Shah. So if you are new, please do not forget to subscribe this channel because I am here posting dental information and tips for you all. So let us come back to the topic. Now cleft lip and cleft palate. So it was mainly understood that the males, or it is seen that the males are more having cleft lip and the palate, the cleft palate is more associated with females. Speaking about the clinical features of how this cleft palate or what are the effects of this cleft palate on the patient who is suffering. So the first and the most important thing, the baby is born with the cleft. Here, there is a gap or there is some line defect. So what would happen? Can you imagine? The most important thing, the nutrition of the baby is hampered. That is the sucking of the milk. There are feeding issues for the mother because there is no sucking pressure created in the baby's mouth because of this opening or this deformity. This sucking pressure is not created and therefore the baby cannot feed properly. So the first thing is feeding issues. The second thing is nasal regurgitation. If there is palatal defect, then there is nasal regurgitation. The milk comes out from the nose. Then there is ear infection chances. It is associated with more of ear infections. And the next one is the teeth deformities. There may be multiple teeth, supernumerary teeth, what we call it as. Then peck-shaped teeth, that is conical teeth. Then there are less teeth, more teeth, no teeth at all. So there are many of this. Then coming to the how are the types or what combinations can you see of this cleft lip and palate? The first combination goes unilateral and bilateral. That is only one side of the body is affected, and bilateral is two sides. Both the sides there are cleft lips that are seen. The next classification in this can also go as only the soft palate. I am showing it you in the picture besides. Only the soft palate that is affected. Then it is the soft and the hard palate that is affected. The third combination is the soft and the hard palate with the unilateral side of lip, cleft lip associated. And the fourth and the final combination is soft palate, hard palate and both the sides of the clefts of the lip. So the clefts are seen here. You can see it in the picture besides me. Now moving towards the most awaited part of this video is the treatment for this. The treatment for this is not only once done. It is to be followed for years. It is almost from birth to 15 to 20 years of that person who is having this deformity. But trust me, the science has developed a lot and you can have best results. People nowadays, in the early days it was not considered a good thing. It was because of the evil powers. But nowadays, the people with clefts do have good life ahead. And yes, you can have a good future. So come, let us have a look at the treatments. So what is given at birth? At birth, the first and the most important thing is giving nutrition to the child, the feeding. So for that, for making it easy, a feeding palate is given. It is basically a feeding plate which is given and fixed to the palate, which helps the baby to feed properly. Then there is pre-surgical orthopedics which is required. Next, coming to 3 to 5 months, when the teeth starts erupting, then there is steps which are taken for the alignment of teeth. Then also when we switch to 12 months, that time speech appliances, palatal repair and ENT audiologist assessment is required. 2 to 6 years, there is dental care like pit and fissure sealants, restorations if there is some caries. If all these things are required, then that is done. At 6 to 7 years of age, orthodontic consultation is required. That is the clips doctor, they walk in. Here is the phase where your ENT specialist, your speech specialist, then there is an audiologist, all these people come into picture. Then there is removal of any supernumerary teeth. That is the extra tooth. If there is some eruption of it, that is to be removed in 6 to 7 years of age. Then at 8 years of age, there is assessment of the bone done. What is the strength of the bone? How is the bone? The density, how can we just do the surgeries and all? That is to be assisted. Then the bone is assisted for if it is good for grafting. So grafting assessment and susceptibility test is done. Review by the speech pathologist and the ENT surgeons is taken at this age of 8 years. Then 9 to 15 years of age, assessment is to be done by the ENT, by the plastic surgeon and by the pathologist and the surgeon. Then the monitoring of the teeth, eruption, the development of the teeth and any orthodontic treatment is required, that is to be taken care in 9 to 15 years of age. So basically, it is multiple years taken for the treatment of this and there are multiple specialists involved in this care. So what I am suggesting is I am giving you a chart mentioning what all other dentists or other specialist doctors which are involved in it, and also rebriefing my treatment on what age what treatment is required. There is a rule of 10 that I am going to mention at the end of this video. So keep watching. At the end of this video, you will get when and how the lip repair is to be taken care of. Do keep watching my shows Monday mornings with Mansi. This topic I am going to keep it very short because this topic is to be handled with utmost care and there is n number of specialists and n number of doctors who are involved in this. Really describing it through a video is a difficult thing, but yeah, I just wanted to make a video on this because there are so many misconceptions yet here in India or in many parts of the world where people still do not accept babies with this deformity. They just neglect that baby. So I want to convey this message that this treatment, this deformity, this disease can be treated. They can have a normal life, and now with good plastic surgeries done, the next person, the front person won't even understand that I or some other person has gone treatment of this deformity. Stay healthy, stay happy. Do like, comment, share and subscribe this channel Dr. Mansi Shah. Stay healthy, stay BeOroFit.